Hi everyone, welcome back to my channel. If you're new here, my name is Raina. I'm a third year, well, technically fourth year dental student at the University of Sheffield. Today's video is going to involve a little bit of help from some amazing people. So I've asked a few dentists and dental students to talk about how COVID has affected them over the past few months, their experiences, how they've been coping, and what changes have been made to dental schools and dental practices. And they're also going to talk a little bit about what they think the future of dentistry may look like. So a massive thank you to all of the people who have so very kindly contributed to my video. Without them, I could not have made this. And I will leave all of their social media in the description box down below, so please go check it out. They do some amazing work in the world of dentistry. So without further ado, let's hear what everyone has to say, and at the end of the video I'll be sharing my own experiences, so do stick around for that as well.
Hi guys, my name is Yuande, and in terms of how COVID impacted me as a student, it had a massive effect because it was my final year at uni. This was the year where you get to do the most clinical dentistry. At this point we had formed really good relationships with our patients, had good treatment plans going. So to have university cancelled and just abruptly ending was just crazy. So in terms of what I got up to, I actually decided to get a job at the hospital as a domestic staff, so just helping out with the cleaning, which was really good. I also got a chance to catch up on things that I just hadn't really had time for in the past, such as playing my guitar and just other bits of work that I put off. So that was really good. In hindsight, I actually really enjoyed quarantine. And in terms of the future, I've recently qualified as a new dentist. Woo! So I'll be starting my foundation training in September. And obviously, in terms of how COVID's going to affect that, PPE is going to be very rigorous. We're going to have new kinds of masks and probably not see as many patients as we would have if it wasn't for COVID. So yeah, it'll be fun to see how that all maps out, and I'm looking forward to it.
One of the most interesting things that I've learned through the coronavirus situation is how important self-confidence when it comes to one's smile actually is, especially with patients and people using video consulting and video conversations and video meetings more than ever before. We can see ourselves in that phone and in that screen, and so the confidence that comes with a beautiful, healthy, natural smile is something that people are still really wanting to achieve. So we have found that actually cosmetic dentistry has been more and more sought after coming out of the pandemic, which is great, and we are happy to help as many patients as possible. The other thing that we've learned is that technology can be used to our advantage to give patients from anywhere across the globe access to dentists like myself and our team to actually communicate using video consulting and video calls, so they can get all the answers, all the questions answered, and all the information that they need before they make the trip to see us.
Hi you guys, my name is Komal. I'm a 5th year dental student slash a dentist, almost. So COVID has affected me quite a lot as a dental student because I'm in final year. So obviously we were supposed to end in May, and we were abruptly told to pack our bags up and leave in March. So yeah, it just ended uni quite abruptly, and didn't get to really say goodbye to any of my patients or any of my supervisors. So that was quite sad. But overall, as a dental student, in terms of studies, it hasn't really impacted me that much. I know loads of universities are basically cancelling lectures and things like that, and they're doing remote learning. But for dentists, it's very hard to do that because we need a lot of practical experience. So I hope it goes down okay, but I have no idea what it's going to be like. In terms of me, I'm supposed to be starting DFT in September, but again, I don't know if that will happen or when that will happen, and it's definitely not going to be a normal DFT.
So I do feel like being a dentist is quite a fast-paced sort of career. During the day, you know, before lockdown, you barely got a minute to even think about what you're going to do. You're always getting the next patient in and out. So having this prolonged period of time, such as lockdown, initially it was quite daunting. I did feel like I didn't know how I was going to fill my days, what I was going to do. But I think with all the webinars that we've had access to, so much online learning, it's been absolutely brilliant. And also having those regular things such as workouts, home workouts, spending time with family, has been really, really good in regards to keeping a routine. Initially I felt quite hesitant, especially being a foundation dentist. How it's going to affect me and my training, but now I feel quite at ease actually with it, and I think it's probably taught me more as I've been able to kind of learn things at my own pace rather than try and rush things. I think it's been quite good for my development. So I do feel like the immediate future of dentistry is going to be a little bit different. Obviously we're already seeing that now, such as like prolonged fallow time, different PPEs, different protocols. But I think moving forward, hopefully we can kind of get to a place where there's like a happy medium. Hopefully we even get to a point where we get back to care before COVID, we stopped seeing patients towards the end of March, and I've kind of been we've been in lockdown, and I've been doing a lot of telephone triaging at the practice, a lot of admin, a lot of the learning kind of shifted to a more so digital platform. So we were doing things on Zoom, loads of webinars, loads of tutorials online. But the main thing really has been, a lack of practical exposure.
Hi, my name's Negi, also known as The Foreign Philosophy on Instagram. I just finished my first year of dental school here at Karolinska University in Stockholm, Sweden. So I wouldn't say that COVID-19 has changed my dental student life completely, considering I live in one of the only countries that hasn't quarantined. But with that being said, all of our lectures have been transferred to an online format. But that's not such a good thing, considering that we just started tooth anatomy and modelling, and that's not quite the same over Zoom. So I've been coping with this whole situation by sticking to a schedule and trying my best to stick to a routine. It's super hard when you're at home, and that's the most comfortable place to nap in the entire universe. I felt like I was just getting into the swing of things with my friends, going to the library, but when you're at home, it was super important for me to just stick to the schedule, routine. And don't beat yourself up for taking a nap. Okay, so it's been a huge amount of teamwork between the student and professors. I'm super proud of my school for handling it the way it has. Even though it's been met with some resistance sometimes, the professors have really listened to our needs. So they have made everything online. They've made all of the exams open book. But to make life a little bit more difficult, it is dental school after all, they've decreased the time limit and they've upped the pass mark to 80%. Post-COVID-19, I feel like dental schools will obviously develop. I feel like they're going to be way more digitally friendly. They're going to be in clinics sticking to protocol and hygiene rules even more so. And lastly, I would say that hopefully we're going to get some more training on how to deal with a pandemic.
Hey, Dr. Bill here. So COVID has affected us in a lot of ways. I want to show you what we're doing. One of the things we're doing differently, we're using the P100 mask. Now the N95 filters about 95% of the air. This guy, 100%. And it looks like Darth Vader. You put it on like this, and then you strap this in the back. Now when you have this on, when you're done, you just spray this down. And these you change about every 60 days. But here's the P100. It's the way to go.
Hey everyone, my name is Catherine and I am a first year, almost second year dental student. And COVID-19 has definitely changed a lot about my schooling. So my school, we do not have a summer break. We just have a full summer semester and it's very lab-based. Or it's supposed to be very lab-based. It was supposed to start in May and go all the way until August, and we were basically supposed to be in lab every single day of the week. But because we weren't allowed to meet in person, at least in such large groups, they decided to cram all of our didactic lecture-based courses into 7 weeks, which turned out to be like watching 10 hours of lecture a day and having like 2 to 5 exams per week, like full-on exams. I just finished that actually. I just had finals last week and I'm so relieved to be done. And now that the state is opening up a little more, we are now going back into lab for the second half of summer. And I'm going to basically be in lab every day with my classmates. We will be wearing full PPE, eye protection, masks, gowns, gloves, all that. Honestly, staying inside and studying from my computer all day has not been the easiest, and it's definitely been an adjustment. I've always adjusted pretty quickly, so in terms of grades, it didn't affect me too much, but it really was tough on me mentally. I think the number one thing that saved me was going outside and going on a 30 to 45 minute walk every day and just clearing my head, getting out of my house. And I'm so thankful for my friends. We always stay in touch. We keep each other on track. We're like, hey, just remember we have this exam this week, like make sure to study for it. All my professors did have like weekly office hours and everything over Zoom. I've never been a big office hours person, so I actually didn't attend any of those. So this whole thing was kind of just on my own. That was partially my choice. Like my school did offer support, I just didn't really take it. The plan is to go back to normal dental school in the fall. I don't really know if that's going to happen. As far as the future of dentistry and dental school, I think we're going to be seeing a lot more temperature taking of all the patients and potentially a little more PPE. We already take a lot of precautions as dental students and dentists, so I don't think it'll change too much, but I do think there will definitely be some changes. So.
Hey guys, it's Dr. Rona, and I've been asked to share a few words of wisdom about COVID. I actually bought a practice just before lockdown, and it was extremely challenging because I suddenly taken on all these new roles and responsibilities and couldn't even work. But as they say, out of adversity comes opportunity, and that's the way I live my whole life and philosophy. I took lockdown as an opportunity to reset, recreate my vision, but also connect with the team and find out how they'd be safe. I made sure that I was really on board with PPE. I wanted to find out what the best way to protect patients and my staff would be, and I ordered everything well in time. I also looked at different types of appointment scheduling and so forth.
Hey everyone, I hope you're all well and safe. My name is Aryan, and I am a first year dental student studying at the University of Dundee. I think initially it was around the 15th of March 2020 when the university announced that, teaching is going to be suspended and everything will have to move online. It's been quite difficult to work from home because I think dentistry is quite a difficult degree, and it's important for you to kind of see your friends going through this together, and it's just different. It's not the same thing, and it really is difficult to find motivation and try and get yourself together. So initially I kept myself busy with doing university work, trying to catch up with everything, and just kind of making sure I am bringing myself up to date and ready for exams. I think it was just after a week, so it was a week into lockdown when the university arranged this advisor of meeting kind of thing. So we've got advisor of studies, and they would email us each week asking us, how we're doing, if there's anything we're struggling with, where we are at the moment, and they've continued teaching just to make sure we are progressing, and our graduation date is not delayed, and we're still going to graduate on the same date, same year that the uni promised us. From what I can see, it looks like we're going to have to wear a lot of PPE in future, so there's going to be a lot of emphasis on PPE. I think a lot of the teaching will be moving ahead through online learning, so the way that's been moving since the lockdown, I think this is probably going to continue and just get better and more advanced as the world is kind of forced to come up with new ways and technologies to continue teaching online.
Going back to dentistry during the pandemic has been really different to what I could have ever imagined working as a dentist would be like. It's really difficult to communicate with our patients, especially with the amount of PPE we're wearing, and a lot of them are finding it hard to hear what I'm saying. I'm quite a smiley person, so I've also found it really difficult not being able for patients to be able to see my facial expressions, and I think especially when it's somebody new, giving them that reassurance is quite hard when they can't see your face and you look like a sci-fi beekeeper in all of your gear. That being said, people have been really understanding and accommodating, and I've actually been quite amazed how accepting everybody has been of the circumstances, and they're all abiding by the rules which have been set in place by the practice. It's been a massive change for all of us, and I was really anxious about going back to work because I was concerned that in general, the way dentistry has been portrayed during lockdown isn't very good. So I was concerned that that would have sort of rubbed off on our patients and that they may think that we had a choice in the matter about when we opened and what we did. So I was definitely pleasantly surprised, and I've also started to get used to the PPE as well. I can't imagine really the whole of the future wearing this level of PPE. I think things have massively changed, and I really hope that it's not permanent, but at the same time, if it's what it takes to deliver safe dental care for our patients, then it's what we've got to do.
My name is Eleanor Shahir. I'm a 4th year dental student going into 5th year at Leeds, hopefully in September. But since the start of lockdown, we've mainly been going through cases. Every week we get a different case uploaded onto this webpage called Top Hat, and then every week we go through it with our clinical tutors and our clinical group. And we've had similar cases but for paediatrics. So far we've had about 10 restorative cases to go through, and we've had about 7 paediatric cases to go through. Been super helpful, really good. We've also had a couple oral surgery lectures just to keep our minds active. We've recently just done a couple formative assessments online, obviously because we missed out on our May exams. They've just given us formative assessments just to compensate a little bit. And we've also had a couple lectures, e-lectures to go through in our own time, both for paediatrics and for another module, which we have an exam in I think November for 5th year. So it's been a bit hectic. You just have to keep on top of, you know, all of your emails, make sure you don't miss any deadlines, miss any assessments and all that kind of stuff. But I think it's coming to a close just because uni is technically supposed to be finished in 2 weeks for us. At the end of July, we're basically done. So just 2 more weeks left. But yeah, other than that, it's been pretty good.
Hey guys, I'm Dr. Vinay. I'm a DCT1 at Northwick Park Hospital, working in oral and maxillofacial surgery. So COVID-19 has affected, if you haven't seen the news already, but Northwick Park Hospital was considered the epicenter of the virus in the peak of the first wave. And so a lot of the DCTs were asked to go to ICU to assist them. Of course, we're not medics, so we didn't have any decision making to do as such. However, we were assisting the ICU doctors, nurses, the A&E doctors and nurses, the anaesthetists with whatever was needed to be done. So it affected oral and maxillofacial surgery heavily. We had no elective surgeries going on. We had no face-to-face clinics going on at the time. Everything's getting back to normal, but yes, of course, dentistry was hugely affected by the pandemic. So in the pandemic itself, we were redeployed to ICU, and we did have a great support network. We had the support of the senior colleagues there. I know there was a lot of support from Health Education England, and also there were so many people wanting to volunteer their time, effort, money. So at the hospital, the safety measures during the pandemic were quite strict. No visitors were allowed to visit their relatives. People weren't allowed to come to elective clinics. In terms of our PPE, it was very strict, having a properly fit checked, fit tested FFP3 mask, the gowns, the hoods, double gloving. There's advice by the British Dental Association to dental practices on how to keep staff members safe by slowly introducing elective procedures. So the future of dentistry, I'm naturally optimistic. So I think the future of dentistry is definitely bright. But for people that are looking at it externally, that have gone into dentistry, and dental students especially, they may be thinking, well, I chose dentistry as a safe, predictable career, but it's not so predictable right now. I think as the pandemic eases, dentistry will get back to normal. And I think it's so important that we have a suitable contract for dentists with the NHS, or you might see a lot of dentists simply saying, well, it's not feasible for me to work in the NHS. So if we want to protect our kind of healthcare system, it's so important that the contract starts adapting to that. So the pandemic had a huge emotional and mental toll on dentists and doctors around the country. For me especially, I love getting involved with things. I love helping out. But at the same time, I had to realize that after a long shift in ICU, it is emotionally draining. I didn't find it as physically draining as working on call in oral and maxillofacial surgery. So I had to make sure that I was looking after my own mental health. yeah, of course, there was so much that I was doing to look after myself at that time.
Hey guys, Rona asked me to make this video for you guys answering some questions. So obviously we were closed for like 3 months, so that affected my practice quite heavily. We didn't have any benefits made available to us as dentists because we're self-employed, so we didn't get furloughed or any government benefits, and we earn more than 50 grand, so we didn't get the self-employed benefits either. So that's fine, you know, that we do earn okay, and so it's okay. It was okay to not earn for that amount of time, and then when we did slowly come back into practice, you know, there's been a lot of protocols put in place, a lot of expense to get ourselves ready, PPE, get the clinic ready, change the way we do things. We bought these virus killer machines, which are air filters that go in the surgery. They were like £1,000 in lockdown. Now they're 500, but they clean out the air in the room in 20 minutes. Yes, I mean, we were one of the first to reopen once it was announced that we could. We have all the safety measures in place. We all came in, we did a run through. Patients are sent a pre-COVID questionnaire before they come in, check they haven't been unwell, they haven't been in touch with anyone that's unwell. Obviously no one's been traveling, and then when they come into the clinic, they have to come alone. As they come in, we take everything from them, their phone, their coat, and everyone's given a mask to wear. They have to disinfect their hands. We take their temperature. Medical history and all paperwork's done online before they come, so they're not spending time at the desk. We've also got plastic shields at the desk so that the reception staff aren't being exposed to people. We try not to use the waiting room, try and keep patients outside until it's time to come in, and then when they come in the room, we have this virus killer. We have a lot of extra suction machines, this like robot thing that sucks the air by the patient, and lots of really cool gadgets, and we have all the PPE that we need, and we also give our patients PPE so everyone's covered and everything's safe. So there's lots of protocols in place. I hope that dentistry will go back to something similar to what it was like before COVID-19, just with these things in place, so we know that if something like this happens again, we know how to act quickly and maybe not be closed down next time. It's not something that can carry on. It's not sustainable. It's very, very difficult to work in the FFP3 mask. You can barely breathe. I feel like Darth Vader hyperventilating. It makes me very uncomfortable and unhappy, actually, and I really enjoy my job. So it's a shame for something to be making my life so uncomfortable, and communication is very difficult. The patients can't understand you, your nurse can't understand you. So it's, hopefully the risk levels will go down and dentistry will go back to something like it was before, because it was always a safe environment. I really enjoyed my time off. I really enjoyed the beautiful weather, spending time in the garden. I was very busy. I was launching my skincare line and at my clinic, so and creating my brand, DRMR. And of course, I've already got my course up and running, Designing Smiles, where I teach dentists how to do smile makeovers with veneers. So I've got a lot of stuff going on outside of clinical practice that it gave me time to work on. And they're all things that give me a lot of joy. And I did a lot on Instagram, and in lockdown, I had like 4 lives a week. Lots of education for people, and people invited me to lives around the world, and I did lives, and it was all great. But also, so exercise, keeping your body moving and keeping your mind busy, and trying to eat well and enjoying the sun.
So COVID has hugely affected everyone and everything, including the world of dentistry, as you saw from everyone's clips in this video. I have personally been off from dental school from March, and it's July now, so that's a very, very long time. I don't know if other dental students would agree, but obviously being a dental student is a huge part of your identity, and when it's been taken away from you, I've just sort of been scrambling to find other things to do, which is what has led me to set up this YouTube channel. So in the past few months, we were having online lectures, all of our work sort of moved online, of course, not the practical elements. And then we also had online exams in May, which went well. With regards to the future and 4th year of dental school, who knows what's going to happen? So far, all we've been told is that we should be going back in September, and a lot of changes are going to be made to how we run clinics, how many patients we're allowed on, and what the PPE is going to be like that we'll be wearing. But I'm really optimistic about the future, and we can see already how everyone is adapting, and I've got no doubt that dentistry will do the same as well. And that's it for this video. If you found it interesting or insightful to hear how COVID has affected dentistry, then please give this video a like, comment down below and subscribe to my channel. Hopefully we will all work together and come out of this stronger, and I will see you all again in the next video. Bye!